Hello, my name's Rahima, the pharmacist on duty today. What can I do for you?
Hi Rahima, I have a blocked nose, so I need a bottle of nasal decongestant.
Um, if you don't mind me asking, how long have you used anything, or why do you want a bottle of nasal decongestant?
I have been using the nasal decongestant spray for around 2 weeks because of my blocked nose.
So you just want me to give you another bottle for that?
Yes,
Um, I believe it's because you're still experiencing symptoms. Am I right?
yes, I am still I want a nasal decongestant again, but when I first used it, it gave me good relief. But now it's no longer working for me. Can you explain me why it's not working for me?
Well, I'm afraid that it's because you've used it for a long period of time. So sometimes that happens. So I suspect you're suffering from what we'll call a rebound congestion. And that usually happens because of the prolonged use of the spray. It tends to irritate the mucous lining, which is inside your nose, and causes vasodilation. Like basically, you have arteries in your nose, so they're dilated. That means they're bigger than usual. That's widening of the blood vessels. Do you understand that?
Yeah, I understand it, but I need a bottle of nasal decongestant.
Um, I'm afraid just that, like I explained earlier, that the nasal spray wouldn't be the best option just because of having another decongestant wouldn't be the best option just because of what I've explained earlier. Because the prolonged use, you having used it for a long time, is what is causing the rebound congestion that you're experiencing now. However, but the better alternative, and which is important to use because it'll make you feel better, is the nasal spray. Do you understand the importance of using a nasal spray instead of the decongestant?
Um, Actually, I don't know anything about Naseline spray. So can you tell me how it can be helpful for me?
Well, um, the advantage of the nasal spray over the decongestant is that it's just like an alternative. But what makes it better is that the nasal mucus lining I was talking about, it will help it to recover, and then it also helps you to break the habit of using a decongestant. So you don't tend to experience continuous symptoms having after using for a long time. Do you need me to clarify anything on the information I just gave now?
No, that's fine. I will use nasal spray. Like, I'm a bit skeptical about it, but I'll still use it. Thank you for the suggestion.
Okay, I understand why you might be skeptical about it. Being that probably you've not tried using the nasal spray before, but I can reassure you that it's very effective, so you don't have to worry about that. Uh, do you have any other questions for me?
Yes, actually, what if this option doesn't work? Like, what should I do?
Okay, thank you for your question. So, if this doesn't work, I'd advise you just to return, and then we can discuss more treatment options and give you further medical advice. Is that okay? Is that clear? Or do you have any further questions or concerns?
No, thank you for your time.
Okay, well, in that case, I'll just go ahead and dispense your medication. But if you have any further questions in future, please don't hesitate to contact the pharmacy. Do have a nice day.
Thank you.
It was 4 minutes and 40 seconds. Starting could be made better because when patient mentioned that I have a blocked nose, so what you should do first is to empathize with them. This is the key. Whenever patient mention any symptoms, the first thing you should do is to empathize with them. This is to build relationship. And then about saline spray, you can simply ask one more question saying, have you ever heard about saline spray? Or you can say, have you ever used saline spray before? It's just adding one more question and it will make your role play look like that you were engaging the patient as well. Like ask as much question you can ask to the patient. And then when you started to explain the difference between saline spray and nasal decongestant, what you can do first, like before explaining the difference, you can say, now I would like to explain the advantages of saline spray over nasal decongestant. Then you can read the script. Why to say this? Like whenever you are going to explain anything, you have to tell briefly that what are you going to explain. This is important because it will make clear that what are you going to explain. It will also come under the heading intelligibility in this way, because in intelligibility it is measured that can you be understood by the patient. So when you say clearly in a brief line what are you going to explain, it will stand out that what are you going to say. It will make the conversation more transparent and clear that what are you going to say. So try to use this thing whenever you have to explain anything. Briefly say the heading that what are you going to explain. Overall, this role plays was very good. I was only discussing the points that could be done more better.